It's not that the industry needs AI necessarily, it's just that AI oftentimes helps automate those processes that need to be automated in healthcare. The telehealth is dead. Helping patients is not only about financial outcomes. We have this paradox. You have great people willing to do the work, and then you have this bureaucracy, this monopolies that are controlling the industry. And so the question is, what do we do about it? The physician should be the final decision maker. Why invest into system updates and technological advances if, in their mind, providers have nowhere to go? The AI is a kiss of death if you're a startup trying to become a public company. We're gonna take over the industry. We're gonna help everybody. It's gonna be great.
Hi, and welcome to our digital health interviews. Traditionally, I'd like to remind you to subscribe to our channel to find out more about digital health. And today, in our episode, I want to talk about some really complicated, often controversial and unpopular topics. And the best person to do this would be our today's guest, Sergei Polevikov. Hi, Sergei.
Hi, how are you?
Good, how are you?
I'm good, Alex.
I really have lots of topics to discuss, so let's not waste time and let's get to our interview. But before I start asking my questions, tell us a bit about your background. What are the main insights into your professional journey?
Absolutely, thanks for having me. My background started many years ago in my deep interest, I would say, in math, statistics, just playing with numbers. And, my dad is a professor, so from early years, I was interested in formulas and how things work and, mathematical proofs. And so, back in my home country, Belarus, I did some formal training in mathematics and statistics and later got into AI and machine learning. When I came to the US, the applications of my knowledge were in fields like economics and finance and fintech, where there is a lot of great people using mathematical and machine learning models to enhance the industry, to make things better. And last almost 5 years, I wandered into healthcare, digital health. With my partner, we started a startup called WellAI, which is still going strong. And the idea was just to help patients, customers with getting direct information from medical literature on the topics that interest them, which most of the time is the daily problems they have, the symptoms, the diseases. And so we actually have an app, I can actually show you a little bit, which is still functional and customers use it. Initially, it was an app that was direct to consumer, but it's a very difficult area. There are a lot of issues like legal and who are we really reaching? Are people gonna use it at face value? And so now we're working with businesses, providers, and clinics. But initially, it all started with this simple app that accesses the database and essentially gives you answers back, and it's in interactive form. So it's a simple app where I can start talking to it. Hi, I woke up this morning and I have a terrible headache.
Here are symptoms I heard you are experiencing. Headache, is everything correct?
So it reads through a lot of information and basically just focuses on the problem area, like headache in this case, and then it goes through, I'm saying yes,
sensitivity to light.
And then it started asking questions. Now questions are targeted based on the data set of medical studies. So if I say headache, it kind of knows with high probability what's typical other symptoms or other questions are useful to ask. And after 10-15 questions, it narrows down to particular probable diagnosis. So as you can imagine, when you are coming out 5 years ago, and we were at the time the only ones doing this particular work. There were a lot of questions. Medical community is very proud community, but also very kind of sensitive to newcomers, and they're like, who are you guys? What data are you using? Is it all legal? Is it not? Is it HIPAA compliant? And so it's kind of interesting just to learn and to communicate and to get, for example, doctors on our board and to develop this project. Right now, the part that I showed you is still a big part of triage process, but now we have so many other things, including telehealth and scheduling and helping the reception with some administrative automation. So it's kind of like the full-blown IT service. So this is where we are with the company. And I also like kind of contributing my knowledge in terms of my writings and my articles. So this is kind of like my hobby, as you probably know. So that's kind of a long story, but that's my story.
Very interesting. So the outcome of this app should be either the algorithm would redirect you to a doctor, or try to schedule an appointment, or schedule a telehealth visit. What should be the outcome?
Exactly. After this, there is the workflow that, for example, you can schedule telehealth, you can chat with a nurse, or you can schedule office visits. So there are some options based on this information. So again, the idea is AI helps aggregate and summarize the data, but in the end, it's a lot about automation. Doctors are burned out, the reception desk, especially during peak times, completely overwhelmed. As you know, phone calls go to voicemail. So now, by having this system, and again, we're not the only ones, obviously, but just in general, having some kind of automated system helps doctors, helps front desk, nurses, patients, the whole ecosystem to streamline the process. So phone calls don't get unanswered because it's in the app. It's all within the app. It's automatic. You don't sometimes need to call the office. So the idea is that the office is not as overwhelmed and patients are happier. So this was the original idea. Again, in our vision, everything was perfect. We're gonna take over the industry. We're gonna help everybody. It's gonna be great. The reality was a little different. First of all, there's competition. There are a lot of innovators in the space, as you well know. Digital health is full of great ideas, gadgets, discoveries, and so at the time we still are pretty unique in how we do things, algorithms. But obviously there are so many ways to automate things. And again, I've said this before in my articles and in my posts on social media. It's not that the industry needs AI necessarily. It's just that AI oftentimes helps automate those processes that need to be automated in healthcare. So this is my story.
One of the reasons you started your newsletter is to explore how healthcare works in this country, and your newsletter is called Brutally Honest Insights on AI and Digital Health. And I do hope that we're going to have a brutally honest interview today. But before that, I want to ask a different question from a different perspective as a patient. How many years have you been living in the US?
Oh, I came in 1995, so it's been 29 years.
Almost 30 years. But for a person who has not been living here for the whole life, and you experience probably other health systems around the world, as a patient, are you satisfied of the care that you receive in this country?
So first of all, I came to America for a reason. I was escaping the regime that was far from free, and so obviously thankful to this country that it provided to me. I've raised my family here. My two daughters were born here, so there's nothing against the democratic system per se, or especially freedom, which gave my family and so many other immigrant families so much. But since you mentioned healthcare, yes, I have a privilege of comparing system we have in the US versus Europe versus Belarus that that I had years ago. And I guess I'm surprised in the fact that how much progress has been done in this country to develop the technology to train the best doctors in the world. But then the system itself, in terms of how you get care, how easy to get access to care, all of those metrics just fail in comparison to other developed countries. And that's what bothers me a lot. And that's one reason I started with my partner, the startup. And that's definitely the reason I started my newsletter. Because again, as you mentioned, as a patient, and I've just experienced that. I think I've told you about a month ago, I unfortunately ended up in the ER, and it kind of brought me back years because I haven't had this experience in a while. And so just the whole experience, just the wait and how everybody's so burned out, from the nurses, from admin staff, how hard they work, but seemingly getting nowhere. The particular hospital I was in, completely overcrowded. They had, beds outside of the rooms. So I was actually in this kind of temporary facility they set up there. I was there overnight, so I guess I wasn't like the most serious case. But it's funny, like it's interesting how great and hardworking the staff is, but then how bureaucratic the system is. They have to make sure that the insurance accepts the claim, then obviously they don't accept right away. There's almost like this thinking, I think, in the medical community that prior authorization is something that sort of magical, that it gets denied at first, but then they look at it and they approve it. And it doesn't have to be like this. In other developed countries, at least from my experience and conversations from people who live there, physicians should be the final decision maker. It shouldn't be a clerk in Cigna or Aetna who decides, oh, this patient had this care. Well, you know what? I didn't think he needed or she needed this care. Even though there's a live physician who just looked at you and who looked at your medical tests, just like literally in your presence. And he or she made an educated decision based on their training, on the symptoms that the patient has today, on the test that the patient just received. And then the fact that some persons in an office, often with no even medical education, just following some check marks, some predefined rule by that insurance company, can just deny it. To me, it's kind of just doesn't make any sense. This doesn't happen in any country in the world. So that bureaucracy, that what triggered me to speak up, to write the newsletter. Again, there are a lot of great things in this country in healthcare. Doctors are great, nurses are great, the most hardworking people in the industry, but the system is set up against them, against the doctors, against the nurses, against the patients. And the system actually benefiting the most. It's the United Health, it's the Cignas, it's the Epics, the Cerners. They're actually reaping the benefits of the system at the expense of the patient. And that what kind of really bothers me. And I'm in my kind of, I guess, work when I'm not doing my daily job, I'm trying to investigate why that's happening, how we can help. I'm actually involved with trying to be involved with some Congress people. Sometimes I'm thinking, maybe it's the regulation. Sometimes I'm thinking actually regulation has nothing to do with this. So maybe it's some other parties that need to kind of decide hard what we can do with healthcare in this country. So a lot of questions, and I post this question in my newsletter, in my posts, trying to involve people, policymakers, economists, data scientists, physicians, everybody who has any good idea. I'm always listening. I'm happy to receive criticism. It doesn't matter, as long as at the end of the day we help the system, we help our healthcare, we help patients. That's what matters.
So sort of to back up your previous answer, by 2000, health expenditures has reached about $1.4 trillion. And in 2022, the amount spent on health tripled to $4.5 trillion. According to CMS, healthcare spending in the United States is projected to rise from 4.7 trillion in 2023 to 7.2 trillion by 2031, growing by average of 5.5% per year. So, and you sort of talked about some of the problems. And yet, I don't think the increase of spendings correlates with the quality of care. So my short question to you would be, what is going wrong?
Yeah, so if you look at the United States healthcare system 50 years ago, it was much simpler. There was no waste or minimal waste, minimum bureaucracy. You know, the 60s and the 70s, basically, the system you have, you get a symptom, you become sick, you go to a doctor, you pay for his service, you go home. I feel like it's at that point where the financialization of the system started in the early 70s with the health insurance companies, and later with PBMs, with TPAs, all these acronyms. But essentially, in a big picture, they're middlemen between the patient and the provider. And the problem started when they become so big, and you mentioned the numbers, that they're actually the biggest part of healthcare, which is ironic. You know, you have doctors, you have patients, you know, where all these other parties come from. So the moment this financialization started with objectives and goals right now completely, I feel like, or very misaligned with the social outcomes of healthcare, that's the problem. So the incentives of these middlemen of PBMs, of health insurance companies, which is often the same group of companies, misalign with the patient needs and with doctors' needs, and that's a problem. If you mentioned those 4.7 trillion now going into 5 or 6 trillion, big part, I think the numbers like 25% is waste. And it was documented so many times in so many studies. It's the paperwork that these companies create. It's the additional technology that has to be created to, for example, what I'm dealing with right now, my company, is to have access to EHR records of the patients that we're serving, which is, you know, ridiculous. But the system makes it so difficult, so bureaucratic to have this access, that it's actually become a huge part of this healthcare spending. So the patients paying out of their pockets, and big part of it is not only paying all these companies, all these executives, but also paying for unnecessary bureaucracy. And that's what bothers me in an era where we have great progress with AI, with all sorts of technology, with innovations. I feel like healthcare is left behind compared to other industries like tech and manufacturing and finance. And I think a big part of the reasons are these monopolies, this huge spending that they create and that they benefit from at the expense of the rest of the industry, of all of us. It's a very unique problem to the United States. As far as I know, none of the other, certainly developed countries, have this problem. And so you have this paradox. You have great people willing to do the work, and then you have this bureaucracy, this monopolies that are controlling the industry. And so the question is, what do we do about it? And that's what I'm trying to think about. Not always have all the answers, but this is what I'm addressing in my newsletters and in my postings, in the interviews. So hopefully together we can find a solution.
Talking about newsletter, well, first of all, we'll definitely add the link, and I highly recommend to subscribe, because literally one of the best newsletters in healthcare I personally found so far. Over the last few months, you've covered a lot of topics and news and scandals. I would definitely want to talk about pretty much every one of them, but we would need days or weeks to do that. But I decided to choose just a few of your recent posts, and I'd like to start with something epic EHR. Your prediction is that potentially by the end of 2024, Epic is going to be hacked, considering that it's the biggest EHR system in the country with over 305 million patients. It would be catastrophic. But I would like to discuss Epic from a different angle. I've been in the US a little over 1 year, and I've talked to around 30 doctors, physicians, and I haven't met a single one of them. And to be fair, not all of them are using Epic, but none of them are satisfied with the EHR system. So doctors are not happy. Potentially it has a lot of security breaches. It doesn't help to solve the problem of interoperability in this country at all. So the question is, why do hospitals continue using it and some even switched to it recently?
It's a great question. So by law, first of all, providers and hospitals are required to have a system that are not only HIPAA compliant, but there are all sorts of compliance issues and particular parameters that have to be satisfied in order for provider, for example, to store patient data and to have access to patient data. So this is where this whole industry started. In terms of why everybody uses Epic or why Epic has so much control, it comes back to the conversation we had basically for the last few decades. For better or worse, we've established a monopoly, or to be more precise, an oligopoly in this country. Basically, it's a cartel, which is a group of companies controlling the industry. So EHR is no exception, EHR industry. And Epic is the biggest player there. First of all, I want to say that there are people who would disagree just completely with what we're talking about here. There are people on both sides, I guess. I feel like, just in my conversations, if you're already in partnership with Epic, you usually have seemingly more positive views on Epic. In other words, once you're part of the club, you kind of feel good about it. For example, you mentioned interoperability. Apparently, I was told that within Epic, it's great. So if there's a hospital using Epic, and the patient was there for some procedures, and then in a different hospital that also uses Epic, so two Epics talk to each other. I mean, the problem is that there's so much fragmentation in this country that once it gets outside of certain system, then we have a real interoperability problem, and that's I think the major issue. But you're right, Epic, is no exception here. It's going back to the monopoly. Once somebody has monopoly power, the incentive is to keep the monopoly power. And the way you do it is to either prevent innovation from coming, or if you see some innovation coming and you think, well, that's inevitable, you kind of like either partner or acquire that, either startup or company. And this is roughly what Epic's been doing. It's not as many acquisitions, although they've had some, but it's this partnership. They have 4 partnership levels. Whatever it's called. It's almost like gold, silver, bronze or something, which they call it differently, but it's kind of interesting. And so they have these partners, and they've created this illusion that they're very innovative, because hey, look, we work with this startup, with that startup. But when you look inside, and you mentioned providers who actually work with the system, they don't see that innovation. So something happens in between, which is hard to explain. But in the end of the day, again, because Epic is such a monopoly, there's no incentive for them to make their system friendlier for providers. It just so why innovate? Why invest into system updates and technological advances if, in their mind, providers have nowhere to go? And providers also are tricked into this idea that, well, this is what we're left with. There's nowhere to go. Is because the same HR companies keep saying, well, try building all this system from scratch. You need to have it by law, right? We have all these laws, High-Tech Act of 2009, the CARE Act a couple of years ago that kind of explain what providers should do with patient data. And they're like, well, try dealing with that. But we're already there. And by the way, we have all this power,
So sorry for interrupting. Let's say, well, I'm personally, my team and I'm confident we can build the best EHR out there, which is going to be user-friendly, efficient, and super secured. But building the tech would not do it for me. Do I need connections in Congress who would lobby the adoption of my EHR? What would a startup need to do in order to make this new HR that's going to be much better than the previous ones be adopted in this country?
Many have tried to build such systems, and actually many have. ChanMed, for example, is one of the more well-known ones. They have their own system. I don't have all the answers, but the bottom line is that it's very difficult to sell this new EHR system when you have this monopoly control of Epics, of Cernas of this world. Obviously lobbying wouldn't hurt. In my opinion, lobbying has prevented innovation in digital health also. Again, for the reasons that, who are the main lobbyists? It's the same group of companies. Epic has one of the biggest lobbies. United Health, I think, has the biggest lobby in healthcare. They're the ones that are doing everything they have, including being experts on drafting the new law. Because, when the new law is on the table, on the floor, who are they going to consult with the Congress? They're going to the same companies, like, oh yeah, because we're the biggest experts. So guess what? The laws are drafted so that these companies keep their monopoly power. And if you're a new company want to build an HR system, they're going to make it very difficult for you. It's not impossible, I don't think. But I feel like the innovators seeing the previous failures of the companies who have been trying to do it, they're looking at ChanMed that, is a great company and actually a large company. But in terms of market weight, especially in the HR industry, not that it's their goal per se, but you look at HR and it's Epic getting bigger, bigger, and bigger. I think I've seen the numbers that in 2023, the new systems that were installed, all the new customers that that EHR systems received, 78% of them were Epic's customers. So you're getting more new not to mention the fact that they already control almost 50% of the market. They're getting even more than 50% market share of new customers. So that number is inevitably getting even bigger. So, and that's, in the end of the day, the definition of monopoly. Again, monopolies don't like innovation because that disturbs their monopoly power. That's the definition. Again, I don't want to discourage anybody, and obviously I'm kind of been trying my best to innovate, to bring the ideas of AI to this industry. So there is no discouragement here. But I'm just saying that's the reality. What can be done about this is a completely different issue, and I write about this, I think, extensively in my work.
Okay, let's talk about another complicated topic: primary care. Primary care is hard. In lots of cases, it's not profitable, and yet so many big companies are still trying to get in and continue doing this mistake over and over again. Why?
Well, there are many reasons. I think one reason is that if there is a big competitor that did something in primary care and failed, a new big company comes in. So let's say, CVS started something and they didn't have much success. Now Walmart comes in and says, well, we've been doing great in retail. We're the ultimate masters of scaling and reducing costs. So how difficult could it be, right? So there a lot of sort of executives, they have this vision that if they did something in one area, this automatically translates into a different area. So they fall into this trap a little bit of the fact that they think that if they did something great in whatever areas, or finance or retail, they can automatically do it in healthcare. And so that's one reason. Another reason is that it's the way the corporations are structured. It's not one person who runs the corporation. You have the board, you have investors. If it's a big investor, that investor, well, actually likely to be on the board, but also likely to have an opinions what the company should do. And so if you are a chief medical officer in a big corporation and you know that primary care is hard, for a whole bunch of reasons, including financial and social outcomes. But then you have the board telling you, we have Amazon just started One Medical. They're trying to conquer primary care. Why are we not doing that? And so if you start asking questions and questioning the board, the way it works in many corporations, you may not end up in a good place. So a lot of CEOs just basically yes men or yes women turned out to be, and they're going with this idea that, hey, if Amazon can do it, or if Walmart can do it, we can do it. And so there's a lot of this going on. But in the end of the day, I think my personal opinion is that all these corporations, they look at financial outcomes. I think healthcare is different in a sense that we have to look at the big picture. And the big picture is that helping patients is not only about financial outcomes. It's a lot of aspects. It's emotional. It's community. It's social. And so when you are very one-dimensional, especially in primary care, which is the number one area, this is where people go if they have day-to-day issues. It's hard, and again, I don't have all the answers, but I can kind of look back and explain why certain ideas or certain projects of these big corporations failed in primary care.
Should we anticipate more newcomers in the space?
Oh yeah, it's the like in the Wall Street movie, right? Greed drives everything. So there are new executives come in
with new fresh ideas.
And they're like, oh, have we ever done primary care before? Walmart, by the way, this is their fourth time in the last, I think, like 6 years or something, where they started their healthcare division, and every time they think that they can do it. In the end of the day, I think healthcare is local. Walmart's problem, as far as I understand, was that they thought they can handle Medicare patients well, but in the end of the day, Medicare patients, most of them, obviously they're elderly, they have their own doctors. So now you're asking, oh no, we have this convenient location, Walmart, and by the way, we have like Walmart doctor now. On paper, it sounded great. Well, you get your groceries, you may as well get your care. But with Medicare patient, apparently it doesn't work like that. Elderly patients, they tend to like their doctors. They've been, in many cases, for decades with one doctor. They know where to go, and they don't like the idea of being served in a Walmart store, potentially with a different doctor next time. So I think there's a learning curve even for these big corporations that have a lot of smart people, but still seems to be learning. So it's an interesting area, and primary care has to be solved. There are a lot of problems. The system is overwhelmed, burned out, financially strapped, and even though it looks like all these corporations throwing money at the companies, but somehow it's the venture capitalists end up with all the money in the end, which is kind of interesting. But again, if we think about the solutions, I think we can come up with some good solutions. And when I say we, it's the whole community. It's, again, policymakers, medical community, academics. So I feel like we need to continue thinking, we need to continue generating ideas. But yeah, corporations are gonna continue kind of trying to expand their empire, trying to conquer healthcare, and in many cases they're gonna continue failing.
Okay, telehealth is another space which looks like things are not going well, and no one is safe, including Teladoc, Amwell, and others. We definitely saw a huge drop after the end of pandemic. But now what I see around the world, the numbers are actually growing in telehealth adoption. So why telehealth business is not doing well?
I would say telehealth is doing extremely well. It's the part of the industry that focused on the so-called standalone telehealth. They're not doing so well. So the original idea with Teladoc was a great idea to essentially connect patients and doctors through video calling, which is not an original idea, but in healthcare, I guess they're the first ones. So at the time, yeah, it was kind of interesting, and obviously early adopters started the industry. But I think, that was it 15 years ago? Probably more than that. So over this 15 years, technology obviously progressed. And now I think what's happening in telehealth industry is it's the customization, it's the way of providing telehealth as a tool as opposed to as a commercial product. So initially there was this commoditization of telehealth, and I think now it's become more streamlined. So I think, if anything, telehealth is actually very popular, especially after COVID. Obviously, kind of that wave subsided a little bit, but there's still, like, I use telehealth. It's very convenient. In fact, there's a certain part of population that prefers telehealth. Why go, drive somewhere when for certain conditions you can just talk to a doctor, and very convenient. So again, the telehealth is dead in the way we remember it from 15 years ago. So we are talking Amwell, Teladoc, there are a couple of others. But the new companies, the more what I call integrated platforms, they're the leaders in telehealth. So it's Doximity, even Hims and Her have telehealth platforms. So it's actually the names that are not household telehealth names, but they've already been in the industry, and at some point they're like, well, let's just add telehealth, right? And again, it's not as easy as just add it, so you have to integrate it. But in the end of the day, you want to have telehealth in a place that you use every day anyway. So for providers, they use, for example, Doximity. It's sort of like sometimes called a LinkedIn for medical professionals. So they come in the morning they open their computer, they already have certain systems. Proximity is one. Obviously, they have EHR system open because this is what they do to take their notes and to enter patient data. So I think EHR companies will be actually very big in telehealth because of that convenience. So again, as I've been saying, standalone telehealth is dead, but telehealth as a whole is a very growing and area with the future.
Okay, interesting. You're one of few who actually publicly criticizes VCs and their strategy, what you call pump and dump. Can you tell our audience more about what the strategy means and how startups fall into that trap and what are the consequences?
So let's start with 40 years ago. So that's when this idea of venture capital and private equity became popular. In fact, private equity back then was called differently. It was actually called leverage buyout, and then they renamed it so it's not as obvious that they're actually borrowing money to finance their deals. But in this case, with venture capital, in the old days, I feel like they were more progressive in the sense that they would communicate with the founders. I guess founders reach out to them with a pitch. They're experts in what's happening in the industry. So they would say, well, yeah, you know what, this idea, the industry needs it. Let's implement it. So we're gonna give you capital, here's the plan. But you know what, you meet your benchmarks. And one of the benchmarks, by the way, was profitability. So, which is kind of interesting. They're talking about ROI. It's not necessarily profitability, but back then they knew that for long-term growth of the company, for sustainability, at some point you need to turn profit. You cannot just endlessly burn the hole in your balance sheet. And so that was the idea back then. And over time, somehow it became this almost like financial trickery. So what's happening right now, which I believe is criminal, and I've had experience working on Wall Street, and there it's obviously people go to jail for this kind of thing. It's very simple, but it's also very subtle. So it starts obviously with the founder, right? So you're a founder, you talk to a VC, and VC says, okay, we're gonna give you $1 million, right? So here's $1 million, and we're gonna come talk in 8 months. So they call it next round of financing. So they may actually bring some of their venture capital, friends in the next round. And
VC bros,
as
you call them.
The VC bros, that's right. And so what's happening now is that oftentimes it's not even about the idea, it's about how you market the idea. So you give money because, not necessarily because it's financially viable or even helping people, but just because it sounds great, it sounds flashy. So you give capital for this idea, and because you get certain equity in return, there's implied valuation, which in many cases they don't talk about anymore because of what's happening. And what's happening is every next round, typically, not always, they increase valuation, right? So if you talk about public markets like stocks, it's millions and millions of stockholders, people who buy and sell stock, decide on the price of the stock. What's happening in private financing, it's a bunch of venture bros decide on the valuation of the stock. So usually it's by the end of the financing rounds, right before IPO, let's say, we're talking probably like 20 different venture capital firms. So we have this 10 to 15 to 20 venture capital firms sitting at the table at every round, essentially. I mean, I'm simplifying, of course. But they're the ones who decide, essentially, by giving a certain amount of money on what the valuation is going to be.
Right, but they still need to see the trajectory in the business plan, right?
Right, but because they never look at profits, seemingly, because we look at IPOs now. I think 80 to 90% of digital health companies are now unprofitable. Right. Certainly and actually technology overall, but certainly digital health, which is complete reverse from 40 years ago when it was actually 10 to 20 that were unprofitable. So one, this complete, almost like 180. So what's happening is that, to answer your question, when you give money to a founder, it's much easier, and actually with the VC's help, to buy your customers, so to speak. So, whether it's through ads or actually those VCs, they actually know people in the industry. So you go to them and say, hey, we have this great technology, can you become our customer? This is not organic growth. So by buying the customers and burning more money than the customers bring to you, it's not exactly an organic growing business, because an organic growing business is when you grow, and as you grow, you become, especially in technology, hopefully, you scale more. So you have digital health company, which is technology companies, and they don't scale. You look at their balance sheet, and they keep losing money. And so venture capital give you money, you increase your revenues because now you have more money to burn. So the revenue multiple becomes more attractive, right? And so they raise even more money. And so there's this vicious cycle of this, what I call artificial price inflation. So by the time, and obviously they need exit. Venture capital, it's all about the exit. Every time I talk to a venture capitalist, like first or second question is like, oh, what's your exit strategy? So it's all about the exit, meaning that they usually have 5 to 7 year runaway, so to speak, for this one project. And after 5 to 7 years, they're like, well, what are we doing now? We need to do IPO or something. And that's how all these digital health unprofitable companies become IPOs. But the way the value at IPO usually, it's they say, well, look, we have all these sales, right? Because they keep throwing dollars into the customers, and they bring more customers like that. Don't look over here. Don't look at our cost side of the balance sheet, but look at the revenues. Look at the multiples there, right? So this is, I'm simplifying. This is how they pitch. And so they have this massive valuations like on the way up, and then here they're going to IPO and saying to investment bankers, by the way, our last round was at this valuation, right? Now with IPO, we're gonna grow even more, so valuation should be even higher. But their reference point is some artificially created private valuation. And if it was on Wall Street, this would be called pump and dump, because you have incentive to pump the price because you are the original investor in the company. And so you pump in the price, and then you look at the financial statements. All of a sudden, a lot of these VCs disappeared because they exited. This was their exit. It's not that simple, obviously. So because they have a lockup period, etc. But there is a way to exit, either through like later rounds of private valuation. And what's happening now, especially in digital health, is you have this pump and dump. You have pump on the way up, so to speak. Then you go to public markets. Public decides on the value of the company, and they're like, well, the company is unprofitable. There seems to be a great vision, but but actually, those are more sophisticated investors. They kind of have the sort of capacity, the resources to actually look deep down into the financials of the company. But the people who are suffering, actual retail investors, they're sort of mom and pop who are listening to this VC, who are listening to these investment bankers at the IPO round, who are saying, oh, this is the greatest idea ever, invest with us. So the trading starts. And usually you have these retail investors who are buying in because they're listening all this pre-IPO rounds, how great the company is. But the sophisticated investors and more so-called short sellers, they're actually dominating the public markets right now, and they're pushing the price down. And so you have this dump that not only coming from VCs right now, but from short sellers and from sophisticated investors who kind of know already what's going to happen because they've seen the previous pattern. So again, it's not always the case, but it seems to be more and more in digital health. Now again, I'm the proponent and a believer that this is not legal. They cannot do it. Why the regulators are not looking into this, I have no idea. But again, I've done some research on my own. There are other people who are doing this. So, I'm open to talking to anybody and discuss this. But to me, it should not be happening. This is unfair what VCs are doing. And at the end of the day, they're becoming rich at the expense of retail investors and actual angel investors. Those are the investors who come in early, taking the most risk, but don't get the benefit. And so this is another group that's suffering because of this later stage, what I call VC bros. So that's a big problem that needs to be resolved.
Well, let's get back to AI, what we started with. And since we don't have much time left, I'll get straight to my main question. So I often go to lots of startup events, and I think around 8 out of 10 startup founders are saying that they are AI startup. And when you start digging, most of them, not all, but most of them just basically connect to ChatGPT with the API to their product. Then NVIDIA is up 156% year to date with all the AI hype. A couple of weeks ago, a company called Tempus AI, and by the way, it was called Tempus just before they went public. And of course, they're also not profitable going to IPO. They have only 2% of their revenues related to AI-based features. So I personally truly believe that AI is going to change the humanity for sure. But the question for you right now is, in 2024, are we in AI bubble just as a dot-com bubble?
It's interesting because there's so many definitions I've heard of the AI bubble, and there's actually a good book, and the author escapes me now, but I'll give you the reference. They're actually talking about the AI bubble. So I don't think it's an AI bubble in a pure definition of sort of irrational exuberance, so to speak, when the price just goes up so much that it's just the valuation doesn't kind of make sense anymore. Because if you compare with like 1990s bubble, those companies, like majority of the companies didn't even have profits. They were just mentioned www and stock price goes up, right?
So as now, as you said, most of the companies go public.
Well, so let's talk about it, because it's funny you mentioned Tempus AI, because I have an article actually coming up hopefully tomorrow on this exact issue. So it's kind of funny that you asked this question. So there is this dichotomy. So if you want to call it AI bubble, then it's definitely AI bubble that has two faces. Because if you look at the tech giants, basically a company who either bought GPUs or are making GPUs, especially if you're making GPUs, then you're definitely on a rip. So companies like NVIDIA, there is also TSM, which is a Taiwanese semiconductor that no one's talked about, but they also make chips that are related to GPUs, and their stock prices are going up like crazy as well. But definitely NVIDIA in this country, people know about it. So it brought the wave up, not only for NVIDIA, but for all of those big tech giants, as you know, who are using their GPUs. If you look at the multiples, they're nowhere even near, by multiples, I mean the price relative to whatever measure you want to use from their financial statements, whether it's revenues or gross profit, net profit, whatever. They're all extremely profitable. They are making actually good margins on their AI models, obviously not as crazy margins as for their core business of data storage and cloud computing, but they are making money. And so from that definition, it's just hard to see how that's a bubble yet. I think we may be getting there, but it's an interesting question to discuss. But again, the other side is this AI startups. And I actually mentioned a few of them. You mentioned Tempus AI. I actually identified in the very recent ones that when IPO, there are 4 companies, 4 startups that either have AI in their name or in their ticker, and all of them down. They're basically down from day one. So it's kind of funny that AI seems to be turning things golden if you're this big tech company already established, but it's a kiss of death. The AI is a kiss of death if you're a startup trying to become a public company. All of them are down tremendously. So Tempus AI is down 30% in 6 days, as you know.
So isn't that the first symptom of a bubble? And talking about Nvidia, you mentioned that yes, they're making good profits, but so was Cisco in 90s with all the .com bubble.
Yeah, I'm just comparing the levels. So if you just look at the price appreciation, it's tremendous. I think just this year the Nvidia is up like 200%. Not to mention, for the last couple of years. But my point is, it's not at the levels, for example, at the tech bubble of the 90s. We're not there yet. But again, if you look at some of the definitions, some of the arguments people are making, I can totally see how we're getting there. And to me, the main definition is that of a bubble is that when people hear something like AI and they just take it at face value without checking any facts about that particular company.
Looks like that's what's happening.
So by that definition, maybe it's happening, yes.
At the very end, I ask my guests to give last piece of advice to startup founders in digital health. What would you recommend them to do or not to do in order to be successful?
Well, I'm going to say exactly what I say in my newsletter. Be brutally honest with yourself. We mentioned venture capitalists. It's easier said than done, but be consistent with your vision, believe in your vision, and don't let anybody, including venture capitalists, change your vision.
I love that. Thank you very much, Sergei.
Thanks, Alex.